Hi, good morning.
Hi, good morning. How are you?
I'm good, thank you. My name is Leonardo Romero. I am a family nurse practitioner student at Indiana State University. I'll be taking care of you today.
Thank you. Nice to meet you. My
Nice
name
to
is
meet you.
Araceli.
Okay, hi Araceli. How old are you, Araceli?
37.
37.
Yes.
Well, nice to meet you. What brings you in today?
So I'm having problems with my skin right now, and I would like you to check. I have psoriasis. I was diagnosed with psoriasis, but my scalp is the worst. I mean, I
Okay.
have a little bit in my elbow, but my scalp is the one that
Okay.
I feel uncomfortable
Okay.
with.
All right. And may I ask, before we get into that, what is your occupation?
I'm a phlebotomist.
Phlebotomist, okay. And what is your marital status?
Single.
Okay. Can you tell me, so when did that psoriasis start?
That started probably like 8 years ago, 10 years ago.
Okay. Okay, and you said you have it on your scalp. Besides the scalp, where else on your body do you have it?
Elbow.
Elbows?
Yeah.
Okay. And how bad is it?
I think the scalp is the one that I feel more uncomfortable with.
Okay.
It's itchy, and
Okay.
then sometimes, if I itch, it kind of bleeds a little bit, and then
Okay.
it burns, of course, if I take a shower. So that one is the one that I'm more comfortable with.
Okay. And when does it get the worst? Is it in the winter, in the summer?
No, I have it year round.
Year around.
Mhm.
Okay. And what do you use for it?
I've been using betamethasone, I believe it's the name.
Okay. Is that the cream?
Lotion
Lotion.
in the scalp, and
Okay.
then the cream on my elbow.
Okay. All right. What have you used in the past for that?
For psoriasis?
Yes.
That's what I
You
use.
use
That's
in
the
all these
only
years?
thing. Yeah.
Okay.
They
all
gave
right.
me another one, but I forgot the name of it.
Okay. Besides that, do you have pain in your joints or
No.
fevers or
No.
anything else?
No.
Okay. All right. Wonderful. So let me ask you, besides that, do you take any other medication besides using the betamethasone?
I don't. Mostly vitamins.
Okay.
Yeah, but
Okay. All right. And are you allergic to anything?
not that I know of.
Okay. Wonderful. Do you smoke or use tobacco?
Probably like 1 or 2 a day.
1 or 2 packs? Or
No,
cigarettes?
cigarettes.
Okay. All right. That's good to know. Do you drink alcohol?
No.
Okay. Do drugs?
No.
Okay. What about prescribed medical painkillers?
No.
Okay. All right. Can you describe your overall health status?
I think I'm pretty healthy besides a few surgeries that I had in the past, and
Okay.
and what I just mentioned. Other than that,
Okay. You consider yourself to be pretty healthy.
Yes.
All right. We'll get to your past medical history here
Okay.
in a minute. So, talking about your medical history, were you ever diagnosed with a medical condition when you were a child, such as like chickenpox, measles, mumps,
no.
no scarlet fever, anything like that?
No.
Okay. Polio.
No.
Okay. What about medical history? I know you mentioned psoriasis. Anything else you had besides that? Anemia?
Oh, anemia. I do have anemia.
Okay. All right. And how long ago were you diagnosed with anemia?
Probably a few years ago, and then I started taking iron,
Okay.
and other than that,
Okay.
I think it's been good.
Okay.
Mhm.
Okay. When was the last time you checked?
Probably like 3 months ago.
Okay. And
Mhm.
how was your results?
My hemoglobin, I believe it was a 12. I
Okay.
don't know.
All
It
right.
was good.
Okay. Okay. That's good to know. Anything else?
No.
Have you ever been hospitalized for the anemia
No.
or for any other diseases?
No.
Okay, that's good to know. So tell me, have you ever had any accidents or injuries?
No.
Okay. Any surgical histories? You said you had a few
I
surgeries.
did gallbladder removal.
Okay, why you?
That was in 2014.
Okay,
5 C-sections and
okay,
a few cosmetic surgeries.
okay. Can you tell me the years of those surgeries? Let's start with the
2000.
C-sections.
2000,
Okay.
2006, 8, 9, 2020.
Okay. What about the cosmetic surgery?
That was probably 10 years ago. I don't remember. But
10 years ago?
2011.
Okay.
And then 2020.
Okay. Can you tell me what those surgeries were for?
Liposuction.
Liposuction.
And the one from last year, lipo with BBL.
Okay. And how did they go well?
Yes.
Okay. All right. Now, how many pregnancies have you had?
5.
5 total. Okay. How many were they all full term or no?
Just my last pregnancy was 34 weeks.
34 weeks.
Yeah.
Okay. All right. When was your last menstrual period?
The 15th.
The 15th of last month,
Yes.
January.
Mhm.
Okay. Do you use any contraceptive methods?
I have my tube tied.
You have your tubes tied.
Yes.
Okay. How would you describe your sexual function?
Normal.
Normal.
Okay.
All right.
Happy life.
Okay, wonderful. So as a contraceptive method, you say you got your tubes tied.
Yeah.
Okay. So have you ever been diagnosed with any psychiatric history?
No.
Or any depression, any anxiety?
No.
Okay, bipolar disorder?
No.
Schizophrenia, anything
No.
like that? Okay. How are your immunizations? Are they up to
date.
date? Okay. Do you
Yes.
have your COVID, your flu
Yes.
vaccine, your tetanus?
All of them.
All of that?
Yes.
All right. Hepatitis? Okay.
Yes.
Good. What about as a child? Did you have all your vaccines up to date?
Yes.
Okay. When was the last time you had blood test, general blood test?
Like 3 months ago.
3 months ago.
Mhm.
Did they check for everything?
Everything.
Cholesterol,
Cholesterol, my A1C, my
kidney function,
Yes.
all of that, liver function. Okay, that's good. And how old are you, Araceli? You said?
37.
37. Okay. When was the last time you had your eyes and your teeth checked?
My teeth probably 3 or 4 months ago, and then my
Okay.
eyes probably like a year ago.
Okay, and how were those? Your
Good.
eyes and your teeth?
My sight is good. I don't wear glasses.
All right.
Yeah.
Okay, wonderful. So now let's go to your family history, okay?
Okay.
How old is your mom?
65?
Okay, and your father?
Probably like 68, 70.
68 or 70,
Yeah.
okay. Do they have, any of them have any diseases that you know of, that you're aware of? Like high
Not
blood
my
pressure,
parents, but probably
diabetes?
my grandparents. I
Okay.
know.
So your parents are healthy?
Yeah.
There's nothing wrong with them, that's good. What about your grandparents?
My grandmother on my mother's side,
Okay.
she has hypertension and diabetes.
Okay,
And then on my dad's side, my grandparent, my grandfather, he died from a stroke.
okay,
So he had heart problems.
Okay.
That's the only thing
That's the
that
only-
I know, I'm aware of.
okay. You said he died of a stroke, right?
Yes.
Okay, what about any of your siblings, your sister, your brother?
She's healthy.
She's healthy, and how many siblings do you have?
1.
One, okay. That's good to know. Do you know of any substance abuse in your siblings?
No.
Okay, what about your parents?
No.
Okay. Do they use tobacco or smoke?
They used in the past, but not
Okay.
anymore. They
All right.
stopped.
Okay. Is there any obesity in your family, your immediate family, like your mother, your father, your...
No.
Okay. Do they have any allergies?
No.
Okay. How would you describe your personality, Araceli?
Happy person.
Okay. What interests you in life?
Going out to nature, going out, traveling.
You like nature, you
staying
like
with the
traveling? Okay, that's good to know. Who would you say is your support source?
My significant other, my mother, my dad,
Okay, that's
pretty much
good.
the whole family.
That's good. How do you cope with stress and with everyday problems?
Breathing, meditation,
Okay,
maybe a cigarette.
okay,
Yeah.
okay. All right, what are your strengths?
My strength, resilient,
You're very resilient. That's good, that's good. What are your fears?
losing a kid.
Okay. Okay, I imagine how that was like.
Yes.
Wow, can imagine that. What's your occupation? You said you're
I'm a
a
phlebotomist.
phlebotomist. Okay. What was the last year of schooling?
You mean high school or?
General. Did you go to college?
I have some college, yes.
Okay,
Mhm.
all right. How's your home situation with your significant other?
Pretty much happy life.
Happy life?
Yeah,
That's
kids,
good.
family, work.
Okay. Have you had any recent sources of stress?
I don't think so.
Okay. Any long-term sources of stress?
No.
No? Okay. Any important life experiences, such as military service,
No.
financial situation, retirement, something
No.
that has changed your life?
No.
Okay.
Everything pretty much has
Okay.
been stable.
Do you have any religious affiliation?
I'm a Catholic.
Okay, all right. Do you go to church?
No.
No. Okay. Do you exercise? What do you do as your hobby, as your lifestyle?
I don't exercise.
Okay.
I work. I walk at work.
You
If
walk
that
at
counts,
work.
like yeah,
Okay.
exercise. But other than that,
Okay.
no.
All right. You mentioned you like going out to nature.
I
right?
like going out to nature.
Okay.
Yeah.
All right. How's your diet? Like, what do you usually eat?
Fatty stuff.
Fatty stuff.
Yes.
Oh, okay.
Everything that is greasy is good.
Okay. All right. All right. So you have no restrictions to your diet, right? Basically.
Not really.
Okay. All right. Do you take caffeine? Drink
Caffeine?
like
No.
coffee or
No, I don't drink
Coca-Cola?
coffee. Coke once in a while.
Okay. Or energy drinks?
No.
Okay. How many Cokes do you drink? I don't know. Let's say every week.
A week?
Yes.
2, 1.
Okay. 2 or 1. Okay. What about your safety measure? Do you wear a seatbelt when you're
I do.
in your car?
Yes.
Okay. Do you wear a helmet when you ride a
No.
bike? Okay.
I don't ride bikes.
You don't ride bikes? Okay. What about, do you have any guns at home?
No, I don't.
Okay. What about, do you use your cell phone when you drive?
No.
Or text when you drive?
No, I don't.
That's good. All right. So anything you want to add? Any health practices that you do that you haven't mentioned to me?
No, pretty much what I just mentioned about my psoriasis. That's my main concern right now.
Okay. So, have you had any weight gain, fatigue, fever, chills, weaknesses,
Not lately.
trouble sleeping that you know
No.
of? Okay. Anything on your skin like rashes, bumps, dryness?
No.
Well, you
my
said that's
dryness.
psoriasis,
Yes.
right? Dryness. Okay. Any hair color changes?
Besides the gray hair coming out,
Some gray
no.
hair. All right. Any headaches, head injury?
No.
Okay. Any ear pain or
No.
discharge? Okay. Any vision problems at
No.
all? Okay. Any stuffy nose, runny nose?
No.
Okay. Any bleeding from your throat pain?
No.
Okay. Any dry mouth?
No.
Neck lump? Any neck masses?
No.
Okay. Any stiffness
No.
in your neck? All right. Any breast pain?
No.
Any masses on your breast?
No.
Any nipple discharge?
No.
Okay. Are you breastfeeding?
No.
No. Okay. Do you perform a manual breast examination?
No, I was not able to breastfeed.
No. Do you perform breast examinations? for
Oh
yourself?
yeah. Oh yes.
Okay.
Yes.
Make sure you do it at least once a month. Okay. Any respiratory problems such as cough, shortness of breath, sputum?
No.
Fever at night or bloody sputum?
No.
Okay. Any painful breathing?
No.
Chest pain, chest tightness?
No.
Okay. Any palpitations?
No.
Okay. Do you have any breathing difficulty?
No.
Okay. Do you have any heartburn
No.
or excessive gas
No.
or diarrhea
No.
or constipation
No.
or changes in your bowel habits?
No.
Okay.
You're asking me for right now, right?
Yes.
Yeah. No.
Okay.
None of them.
Any rectal bleeding?
No.
Okay. What about yellowing of the skin or your eyes?
No.
Okay. What about urinary? Is your frequency normal?
I think it's pretty much normal. Yeah.
Okay. Do you have any pain when you urinate?
No.
Blood in the urine?
No.
Okay. Do you have any incontinence?
No.
Okay. Do you have any calf pain or leg pain,
No.
soreness? Okay. What about varicose veins?
No.
Okay. Leg cramping?
No.
Any muscle stiffness?
No.
Redness of the joints or
No.
pain? Okay. Any swelling?
No.
Any trauma to your joints or to your body as a general?
No.
Okay. Have you ever had any dizziness, any fainting, any seizures?
Dizziness when I was pregnant, but now
Okay,
I'm
now
okay.
you're normal.
No.
Okay. Any weakness, any numbness?
No.
Okay. Any tremors?
No.
Okay. Do you bruise easily or bleed
No.
easily? Okay. Do you have any heat or cold intolerances?
No.
Okay. Do you sweat or urinate frequently?
No.
Okay. Do you have any thirst or changes in appetite?
No.
Okay. Do you feel nervous, stressed?
No, just the normal stress.
Okay. Depressed?
No.
Any memory loss?
No.
Okay. Thank you so much. Now I'm gonna ask you. I'm gonna review with you what you filled out before coming into the practice today.
Mhm.
And we did the mini mental status, and you did pretty well. So you had the full 30 points. That's good. You were able to answer all the questions
So
correctly.
I'm not crazy yet?
No, you're not losing
Okay,
your memory yet.
okay, great.
That's good. Now the other one, the opioid risk tool, you did not have any. You did not answer any yes to any of them. So your family history they don't drink alcohol, they don't do any drugs.
No.
You don't do that either. That's good. You don't have any mental disorders. That's good.
Not yet.
Not yet. Hopefully it doesn't happen, right? And the general anxiety disorder, you just scored a 1. You said you become easily annoyed or irritable sometimes. Okay.
Sometimes.
All right. Okay. How is that? Can you tell me about that?
I will say my kids
Your kids sometimes?
when they don't listen to me.
They don't listen to you?
Yes,
Oh,
but
okay.
other than that, I mean, it's not frequently, or
Yeah.
I'm not mad every day.
Yeah.
But yeah, I
Okay.
will get it like everybody, like a normal. I will
Okay.
say normal.
Okay.
Yeah.
That's good. That's good. So yeah, that was a score of 1. So not even my mild anxiety. So I mean, we all have stuff from time to time.
Yeah.
So now I'm gonna do with you here. I'm gonna ask you 9 questions, and this is to screen you for depression. Okay?
Okay.
And I'm gonna ask you, and you're gonna answer me if you felt any of these that I'm asking you, and if you did feel any of this. If it's some days, half of the days, or nearly every day that you feel this.
Okay.
Have you felt little interest or pleasure in doing things in the
No.
last 2 weeks?
No.
Feeling down, depressed, or hopeless?
No.
Okay. Trouble staying asleep or sleeping too much?
No.
Okay. Feeling tired or having little energy?
No.
Okay. Poor appetite or eating too much?
The eating part.
Okay. Like in this past 2 weeks, is it every day or some days or half of the days?
In between.
In between?
Yeah.
Okay, so half of the days. All right. Do you feel bad about yourself, or
No.
that you're a failure, or that you let yourself or your family down?
No.
Okay. Trouble concentrating when reading the newspaper, watching television, or nowadays being on the phone?
No.
Okay. Moving or speaking too slowly
No.
that other people have noticed, or the opposite, too restless, too fidgety, that you move around more than usual?
No.
Okay. Any thoughts that you will be better off dead or hurting yourself?
Oh no.
Okay, that's good. So you just answer, your score was a 2, which is very minimal depression. Okay, and you said you have been overeating lately, like half of the days. Can you tell me more about that, please?
I think for me right now, since I just had the surgery, I just feel like I've been not eating right and just
You've been craving a lot of stuff.
craving,
Okay.
stuff that I'm not supposed to. So I just think I'm self-conscious about the surgery, and
Okay.
then just the
Okay.
eating part. I don't know if that has something to do with it.
Okay, so since you said you have been eating more than usual, how has this problem affected your your performance at work, taking
no.
care of things at home, and
No.
getting along with other people?
It doesn't affect any of them.
Okay, nothing, not difficult at all. So you
No,
can perform
I
all
can
your
perform.
tasks.
Yes.
Okay. All right. Wonderful. Well, Araceli, do you have anything else you want to add?
No, pretty much like I said, it's just my psoriasis that I'm concerned about. It's just flaky, and it's just, that is embarrassing, you know, having
Yeah.
to have those flakes in your hand when you're talking to somebody. It's just
Yeah. Okay.
annoying. But other than that, that's pretty much why I came to see you.
Okay. Well, thank you so much. I'll be seeing you in a minute. Okay.
Yes, thank you.
Thank you so much. It was nice to meet you.
It was nice meeting you too.
All right. Thank you.
Thank you.